Quite a common question for patients when they come to see us for consultations is, are implants painful? The answer to that question is definitely no. The surgery is done under usually local anaesthetics. You're lovely and numb, so you don't feel any pain at all for the procedure. And even afterwards, a lot of patients don't even need any painkillers because the pain is so minimal. So it's quite a common thing that patients think it's going to be sort of really painful procedure before the procedure, as well as obviously after the procedure, but I can promise patients that there'll be no pain at all. Implants are really safe. They've been actually around for close to 70 years, and the orthopedic surgeon discovered them. And in the old days, the implants were placed and left for a whole year before you got a tooth. So, patients still think the journey's a bit long, but at least you're not waiting a whole year for a tooth. So they're very, very, very safe, and you've got nothing to worry about regarding implants. Average cost for a dental implant, which is the thing that goes into the jawbone, and the tooth that goes on top, which is the bit that you as a patient care about, average cost for that is around £2,500. That's the average cost for dental implant treatment. However, each case is individual. Obviously, if you come for a consultation, we'll have a full assessment. We'll look inside your mouth to see what's going on. We'll take a 3D X-ray, which we have on site, and that will allow me to come up with a specific treatment plan for you, because some cases are straightforward, some are more complicated, and the only way we can kind of work that all out is by assessing you fully, which usually includes a 3D X-ray. Regarding implant lifespan, if you look at the research on implants, they can last up to 50 years. As long as you're medically staying fit and well, you're looking after them, doing all the right things, coming in to see us regularly for your checkups and your hygiene visits, I would anticipate that you would have your implant present in the mouth for a good 10, 15, 20 years plus. Unfortunately, they are in the body, and there's always a risk that your body might change with time. However, the chance of that generally quite low. Patients are always quite anxious about the dental implant journey and procedure, because it does sound quite daunting when someone says, I'm going to put something into your jawbone. But in reality, most of our patients would say to you that if we didn't tell you what we were doing and we were just going to kind of put some blindfold on you and numb you, you wouldn't know if you're having a filling done or having a clean done, because all it feels like is a bit of pushing, a bit of pressure, a little bit of buzzing in water. So it's really not as invasive as patients sort of see in their head, but I understand why patients get quite anxious about it. So procedure-wise, we get you lovely and numb, we do a little bit of surgery, we put a couple of stitches in just to hold the gum back together again, and that is it. It is pretty straightforward. Implants are right for everybody. Ultimately they're giving you an improved quality of life. That's what they're aimed for. My sort of analogy for patients is, God forbid you lose a limb, you'd have an option of having a missing limb and sort of something as support to walk around with, or alternatively, you could have a bionic leg. Dental implants are a bionic leg. They're not your own tooth, but they're as close as you're going to get to your own tooth. So they're giving you something that's going to improve your quality of life, allow you to eat better, smile if it's one of your front teeth. They'll feel as comfortable as any of your natural teeth would. So they are the best option we have to look after your dental health if you're missing teeth.